So in 2017, we launched or published our report, the Lancet Commission on Global Access to Palliative Care and Pain Relief. And this was an effort of 61 authors over the course of 3 years, representing 25 countries. And the three main points that I want to highlight from that commission is the moral failing of the global health community for neglecting the issue of palliative care. This is an area that affects any patient from point of diagnosis till the end of life, and it's often misconceived that it is only an issue for end of life. And we've identified through the work of the Commission the global burden of suffering, serious health-related suffering. There are 61 million people globally and annually who experience serious health-related suffering. And many of these individuals, majority of these individuals, approximately 80%, live in low and middle income countries where there's little or no access to palliative care or pain relief. And hence, there's an ethical imperative to address this gap. What the Commission also did was identify the cost, calculate the cost of an essential package of palliative care services. And we identified that approximately $145 million at best international prices would address this gap through this essential package that can be integrated into universal health coverage schemes. And at current prices, that figure would be $600 million. So obviously you can see there's a bit of a gap depending on how you negotiate. We're working towards helping countries negotiate access to better prices, the best international prices, because the cost of addressing this gap is approximately 3% of the cost of the overall UHC package of health services. So that's a small percentage of what is required to address this incredible burden of suffering. I think there is much more recognition that this is an issue. I should highlight that one of the problems why one of the reasons why we're in this situation is the way priority setting currently works. We focus often on extending life or extending productivity, and it's not as much about addressing or alleviating suffering. And so I think there is, as a result of the Commission's work, I think we've provided a framework for people to reference and to quantify figures, evidence that demonstrate how large this burden is. The INCB, the International Narcotics Control Board, has been interested in improving the data they collect from countries on distribution of morphine equivalents. And so we're hoping that our framework will help improve measurement and assess actual consumption, because right now we're using distribution as a proxy of access. The other is countries themselves, partners from different countries, are interested in identifying what the exact cost is of the essential package in their country. Because while we used evidence from different low and middle income countries, our data, some of it is projected. Well, there's global projections. And so there is room to calculate specific figures based on country level data. And so we've had interest from specific country partners to calculate that figure. And that's an important step because there's interest in trying to adopt and potentially consider an essential package of palliative care services. In some cases, ministries of health, and others, civil society, because I think we need to push for a movement, an advocacy movement that highlights this problem. So we've generated the evidence. We have an implementation working group that is the next step of the Commission, so that we can take this evidence and translate it. And so all the regional and global associations on palliative care have convened. And there's an effort to ensure that there's appropriate messaging and that this evidence goes out to the ministries. And then when it does and the ministries are interested, then we continue that conversation. I mean, like anything, I think it'll be incremental. I think some countries are further along it's timely. Chile, for example, I think they're undergoing some reform in which this is an important time to consider addressing palliative care, because they already have done a lot of work around addressing palliative care for cancer patients, but there's an opportunity to address the issue for other patients with other conditions, other NCDs, for example. There is indeed a long way to go, and in fact there is more research to be conducted as well. As I mentioned, We've done a part of the work in creating these projections, but we couldn't do more because of the lack of data that's available. So we need to strengthen the data that's out there. Second, this is a preliminary estimate because of the data limitations. And so there's a lot more work that can be done around estimating cost, around even the burden, what conditions we've considered in our estimation of serious health-related suffering, what symptoms that we've incorporated. Further, this idea of valuing palliative care. What is the value of palliative care to patients? We are only scratching the surface around that, and we need to understand the patient perspective. And so we need to elicit those patient preferences, patient need, as well as caregivers, what their perspectives are. So there's still a lot of work that needs to be done on the research and evidence generation front that will be ongoing alongside the translation. No, I think that the Congress has been an incredible opportunity to link with like-minded individuals who want to push this area forward. So I want to thank UICC for the incredible work they've done in organizing this meeting.